alpha-glucosidase inhibitors. These are in here more for completeness sake than anything else. Mechanism of action, these inhibit the breakdown of carbohydrates so that you can't absorb them. So basically, you never get to monosaccharides. You always have disaccharides. So is their mechanism of action. They don't do a lot as far as reducing A1C, so about 0.5% to 1% maybe. And the other thing about them is that they have a notorious side effect. So if you eat it with, if you eat something that's got a bunch of sucrose in it, i.e. like a candy bar or a cookie or something like that, then the patient will not have many friends very long because of all the flatulence that they will have. So if you have an unsocial patient that eats a lot, I had a patient like this, and a patient who, just ate everything. I think she was also on like atypical antipsychotic drug or something too, and that I used it with, and didn't have any friends. And it's not a bad choice, but for the average person, I'm being a little bit sarcastic, but then I wouldn't recommend it a lot for that reason. And the big reason is just because your A1C reductions that you get are really pretty minimal from it. Any questions about that? Okay, now you guys are all probably like, finally, we're going to talk about incretins. Did any of you all hear about incretins in medical school? One person? So, okay, I'm glad to know, because I ask this every year, because I heard nothing about incretins when I was in medical school, and so one person has, but I'm sure the new, the young bucks that are just coming through medical school are learning all about incretins, and will be able to teach us much more about them. Now, I think this is a pretty cool slide, and I stole this off the internet, but incretins, this is basically what the definition is. These are gut-derived factors that increase glucose-stimulated insulin secretion, okay? So that kind of explain what they are. They're made by the small bowel, okay, in response to a glucose load. And then when it happens, then they send hormones that affect your pancreas, that affect your liver, that affect your brain, that affect your stomach, a lot of different things. And so it's like an endocrinologist's dream, The name incretin, you can see them there underlined in black, intestinal, IN, secretion, CRET, of insulin. So that's where the term incretin comes from. Now, all right, back to schematics. So here's what happens. In the incretins here, so you eat, hot fudge sundae. I don't know what it is. That's a sandwich. I thought that was a cherry on top of ice cream. No, that's a tomato on top of a sandwich. Goes into your stomach, and then what happens is your gut releases incretins, okay? And so these incretins are these things right here, GLP-1 and gastrointestinal peptide is what this one is. And they cause your beta cells to release insulin and to cause your muscle and fat cells to suck up glucose. And then they also go to the liver and say, hey, you know what, we're fed now, you can stop making glucose because we've got plenty that we're getting ready to dump in the bloodstream, and so stop making it. And so it shuts down gluconeogenesis. The net effect is the blood sugar goes down. And then they also have some other effects. Now, so medicines like Victoza or Byetta, those are GLP-1 analogs, okay? That's what those medications are. Medicines that are DPP-4 inhibitors, so what are the names of some of those? You guys know those, right? So Januvia or Onglyza. And the numbers of these is just, these are what ARBs were 10 years ago. I mean, they're going to keep going up and up and up. But what they do is they block this enzyme here. It's basically it's an enzyme that breaks down this protein, these proteins right here, okay? And the one thing about this enzyme is it's all over the body. It doesn't just affect incretins, okay? There's other hormones in the body that are affected by DPP-4. And so that's just interesting, I think, to know. The other thing about it is that the drugs that we use, like Byetta or Victoza, when you give those drugs, you're giving them in supraphysiologic dosages, okay? And so it's like really, really big doses versus this where you're just blocking the degradation of endogenous incretins, okay? So if you've got plenty of incretins around and you take a DPP-4 inhibitor, then it'll work great. But if you've got diabetes and you take a DPP-4 inhibitor and the amount of endogenous incretins that you're making is not going to have as much of an effect. Does that make sense? All right. So here's examples of the GLP-1 analogs that we just talked about. Exenatide and liraglutide, Byetta and Victoza is the new kid on the block. They're very similar in a lot of ways. They have some differences as well. Byetta was the first one out, and it's dosed twice a day. They're trying to come out with a once a day or maybe even like a once a week dosing of Byetta. So you can see where that's going to be headed. The big selling point with Victoza is it's a once a day dosing, and you don't have to, give it with regards to a meal, whereas with Byetta you are supposed to do that. They both have to be started at a slow dose and titrated upward. Because the biggest side effect is nausea. All right. They are indicated for basically a type 2 diabetic who's failing insulin. We talked about the lead-in dosing to reduce side effects. Most common adverse effect is nausea, like I just said. Weight loss is common. The average weight loss with Byetta is about 12 pounds over 2 years. But that's variable. You'll have some people who will lose a lot more weight than that. You'll have some people who might lose less, but it depends how big they are to start with. Now, if you do start these and they're on a sulfonylurea, then you need to reduce the sulfonylurea to the lowest dose because you will increase their risk of hypoglycemia substantially if you don't do that, okay? Any questions about those two medications? We're going to get to that. The price, they're expensive. Multiple sites, these drugs, this is where they work. They work on the brain to tell you that you're full. They make you have satiety. In other words, make you nauseous. Beta cells, they make glucose-dependent release of insulin happen. They slow gastric emptying. They shut down glucagon production from your liver. They inhibit glucagon secretion and therefore decrease gluconeogenesis that occurs in your liver. This is a comparison of A1C reduction of exenatide. These are basically people who are 1 or 2 oral hypoglycemics and were not controlled. And when the medication was added, how much A1C reduction they got, it was somewhere between about 1.2%. And the amount of body weight that they lost was about 12 pounds. And that was over 2 years. That's what I was just mentioning. The next slide is interesting because when it used to be you got to the point where somebody's on 1 or 2 drugs and then it's insulin. Now it's on, 1 or 2 pills and then insulin. Well, now you have 1 or 2 pills, insulin, or GLP-1 analogs is kind of where we are now. We'll show that in just a second. This was actually a comparison comparing Glargine or Lantus right here in the orange, comparing it to Byetta. And over 26 weeks, the amount of A1C reduction was fairly similar. And again, these were people failing 2 oral hypoglycemics. And the amount of weight difference, you can see with Lantus, weight went up about 4 pounds, whereas with Byetta, weight went down about 4 pounds. So, of course, that's the big selling point is you get weight loss, and you do get some A1C reduction. This shows the dosing for Byetta. And I don't have one of these for Victoza, but basically you give them the half-strength dose, the 5 microgram twice-a-day dose for a month. If they tolerate it, then you can bump them up to the 10 microgram twice-a-day dose. Victoza has 2 steps before you get to the full therapeutic dose, and so it's a little bit different in that regard. I think I mentioned that you want to reduce sulfonylureas to the lowest dose if they're on them. But they don't have to adjust, check their blood sugar more frequently or anything like that.